Hello doctors, today we will learn about the fatty liver and it's also called as hepatic steatosis. First we will see definition. Fatty liver is a condition where lipids, mainly triglycerols especially, accumulate excessively in the liver cells. In the name also you can understand that liver deposition in fat, hence it's also called as the fatty liver. Normal lipid content is in the liver is 5% almost. Then what changes will occur in the liver when it's become fatty? Normally lipids present as small droplets in Kupffer cells in the fatty liver. Triglycerol droplets will entire cytoplasm of hepatocytes, leads to impaired liver function and may progress to fibrosis and cirrhosis. Then, what are the causes of the fatty liver? First is increased triglycerol synthesis due to increased mobilization of free fatty acids from the adipose tissue. Then, free fatty acid influx to liver is more than the utilization of free fatty acids. There is dysfunction of liver cells, hence influx of free fatty acids is more than its utilization, leads to overproduction and accumulation of triglycerides. Then associated conditions that diabetes mellitus, starvation, alcoholism, high fat diet. In these four conditions can be associated with fatty liver. Star points are there that alcohol inhibits fatty acid oxidation and promotes fat synthesis and deposition. Hence, alcohol consumption is also major reason for the fatty liver. Impaired synthesis of lipoproteins, that very low density lipoproteins formation occurs in liver. Required components are the phospholipids and apolipoprotein B, that causes impairment in defect in phospholipid synthesis, block in apoprotein formation and failure of lipoprotein formation or secretion. Then defects in phospholipid synthesis. How? The dietary deficiency of the lipotrophic factors, that's the choline, betaine, inositol, deficiency of the essential fatty acids occur. Then inhibiting protein synthesis. Chemicals like puromycin, ethionine, carbon tetrachloride, chloroform, lead and phosphorus, etc. Blockage in synthesis of apoprotein B required for VLDL production. Then lipoprotein synthesis. Decreased availability of ATP, pyridoxine and pantothenic acid deficiency occurs. Deficiency of vitamin E, that selenium acts as the protective agent. Endocrine factors, ACTH, insulin, thyroid hormones, adrenocorticoids promote deposition of fat in liver. Then there are the two main reasons can be there. Main reason is alcoholism, but there is also due to non-alcoholism. Due to alcoholism, impairment in the citric acid cycle in alcoholism and acetyl-CoA accumulates, leading to fatty acid synthesis and triglyceride accumulation in the liver. Uncontrolled diabetes and consumption of the high fat diet associated with fatty liver. Then we will talk about the lipotrophic factors, that the substance the deficiency of which causes fat to accumulate in the liver, important for normal mobilization of fat from the liver. These are the important for reduce the fatty liver. These the important lipotropic factors, that choline, betaine, methionine, inositol, and to some extent folic acid, vitamin B12, glycine, and serine. Action of lipotropic factors. The choline and inositol are the components of the phospholipids, hence required for their synthesis. Transmethylation reaction and severe protein deficiency that causes the fatty liver. This is the example that if any child that faces the kwashiorkor that is very thin, then fatty liver is occur or not in that situation? Yes, kwashiorkor may be there and fatty liver may be there in thin persons, in thin childs also. Not only for obese persons that have diabetes or anything. The choline deficiency and fatty liver, decreased phospholipid synthesis, impaired formation of lipoprotein membrane, reduced synthesis of carnitine, that is insufficient supply of methyl groups, and impairment in fatty acid oxidation. In previous videos, you have learned the fatty acid oxidation means beta oxidation. In my previous videos, you can go through that also. This is the diagram. This is the liver. These are the free fatty acids formed due to diabetes, starvation, alcoholism. From the adipose tissue is formed free fatty acid, then it's enter into the liver in the form of acetyl CoA. Alcohol does not allow to go into the TCA cycle. Then acyl CoA form triacyl glycerol, and high fat diet also increase the fatty liver, and in this way triglycerol means the fatty acids deposits in the liver, hence fatty liver occurs. Hence, if you like it my video, my notes, please like, share and subscribe and wait for next video. Thank you.